Okay. We have a group of gentlemen from Gore, a WL Gore company, which actually manufactures the device that we're going to be using today. It's the device called Gore Helix, and our hospital has been deemed a training site for them, and we're also doing a large randomized study called the REDUCE trial to look at closing patients for stroke. So large shunt, and it's slightly aneurysmal too. So if you've got a classic atrial septal aneurysm with a PFO and large right to left shunt, it's like textbook for high risk for stroke. The wire has got a small preformed angle that I use to turn the wire into the hole. I know I'm right where I want to be. Right just inside the ostium of the left upper pulmonary vein. So that's perfect. The balloons come in three sizes: 18 millimeter, 24, and 34. And so we're going to put the balloon on the wire again. This is the same balloon as we used earlier. Lights down, please. So this is the same balloon. We go over the wire into the sheath. You got wire? Okay, so we're just going to advance that. Just going to make sure, pull the wire back a little bit. Okay, not too much. I'm just going to inflate the balloon and see how big this thing is. That's going to be a 20. Good. So I'm just confirming on the ultrasound that there's no color around the balloon, and that's sometimes we find an associated ASD with that, and I don't see any of that. Good. Off. So right now I'm just deflating the balloon, and I can see on ultrasound it's deflated. This way I save on fluoro too. I don't X-ray. It measures 5 millimeters at the waist of the balloon. And that's how we size this. We can size it on ultrasound, but we're just gonna go ahead and close it, because that looks visually about right. So you have to have a 2-to-1 ratio with the hole diameter and the device, so that would make it at least a 10. So I just chose to do the 20 millimeter device. So I'm going to put the stopcock on the end again. That's to flush the system. This is the actual device. This is a 20. So it's just under an inch. So I'm going to go ahead and flush the catheter. Get the air out first and then pull it back in. So is there any bubs coming out of there? So we just look down here to see if there's any bubs. No bubs. Okay, so I'm going to go ahead and start pulling it back. So now we're retracting the right disc in, and it's basically, again, a long wire, nitinol wire that's covered with Gore material.
EPTFE.
EPTFE. Excellent. Get a little bend in the tip and loosen this up and then pull it back in completely.
No, we need a little more of that. Push it out with the gray. Push the gray out to lock the mandrel down.
Okay.
Push the gray out. There you go, lock the mandrel. Just pull back, get a little more of a bend. There you go.
Okay. Good. I'm going to have to torque this in there. Basically what that does, it allows the catheter to... Okay, pull it out, wire out.
Wire's out.
When you torque the catheter, it reduces the friction of the catheter on the defect hole. So now I'm going to look on ultrasound to see where we're at. And watch the device being deployed. Thank you. So now we're unraveling the device. So this is the left disc we're doing first. I want to get it on ultrasound so we can see it nicely. There it is. So now you can see the device is down there and up in towards the left upper pulmonary vein. And I'm going to go ahead and keep advancing it in that area. So that way I know the left disc is on the left atrial side. And there's the center eyelet. So now I pull it down and pull it back into the septum. So now I can see that it's over in the septum there. And now I'm going to pull it back, pull back the green catheter, and use that gray catheter as a rail. Screw the small part down, and then I'm going to advance this catheter there. Sometimes when they're this small, you tend to pull apart a little bit. It looks pretty good there. Thank you. Okay, that looks good. So now we're going to take off the red cap. Can't forget that. And I'm going to pull it apart here. Watch it underflow. So it's supposed to drop away, which is what it just did. I'm going to pull this all the way out. So now the device is actually implanted, but we still have it. I still have it secured, so I can pull it back in. Can you go LAL 30? So if I don't like the position, I can pull it back in. Good. You can see the loop. You can see the loop. That's the way it should look. I'm just going to pull this up a little bit closer to the... I usually pull up the catheter just a little bit up closer, just so it doesn't have a long way to put tension on the device. Okay, device is deployed. Let's look at an echo. Yeah, that's perfect right there.
It's beautiful.
It's laying perfectly down. It's not splayed. It's very, very parallel, both discs. We'll do a bubble study here and
I did have a little bit there.
give me a little more. Just give me like 10 cc's. Excellent. I just put a cc of air and draw some blood back to help with agitation. This just creates nice micro bubbles. And I inject them. And she has no shunt anymore. It's gone. It's closed. That's perfect. Okay. Very nice. I'm very happy. She's going to be thrilled to hear this.